I think in large part we went from kind of a normal to closed down, and now we're trying to find that balance between opening up and getting back to work and getting back to our normal lives as best we can in somewhat of a new normal where we are trying to balance that with reducing the spread of and reducing the threat not only to my own self as an individual, but as you said, that I don't want to be a threat to somebody else and potentially worsen their life and worsen their health. And so it's finding that balance. We know more than we did in January, February, and March, and I think that's one advantage. Now, we don't know as much as we want to know. There's more data that's going to be coming out, and sometimes we'll hear about this study that contradicted that study, but that's just the way knowledge works. We're going to learn more and more. So we do know more. We also know the effect that having this many people infected, what those, how many of that translates into a hospitalization, into an ICU bed, into a ventilator, and things like that. So we're trying to manage that capacity of our healthcare systems in our community, in our state, in our nation, to say, well, we can open up this much, it's got this much risk, but we can manage that risk because we have the resources to do that. Nothing is going to be absolute. We all want absolutes. We want to say, okay, if I do this, I will not get the virus. It doesn't work that way, unfortunately. And if I do this, I will get the virus. It's all going to be about risk. I was thinking about this the other day, riding my bike. I like to ride a bicycle on the road. So I'm road cycling, and I'm thinking, okay, how can I avoid injury while road cycling? Well, I wear a helmet. I wear bright clothing. I have a flasher on the back of my bike. All those lower my risk. But the only way to eliminate the risk is to not go road cycling, right? And so I have to decide, is it worth it for me to have that risk? The same is true of coronavirus. If we wall ourselves off, we live in such a way that we have no outside contact, no outside physical contact, no groceries being delivered, never going to the store. I'm going to grow all my own food and process it and never see anybody else. Yeah, there will be no coronavirus risk for you. But how realistic is that? So we have to balance those things. It is, and it absolutely is, and what you just said is absolutely right. Let's talk about why you and I are not wearing face masks. So ideally we should be, but the reality is with the microphones, it'll be somewhat muffled and they will not be able to hear us, and people who are hearing impaired won't be able to see our lips. So we want to make sure that we can get this information out. So you and I right now are taking a calculated risk. Now we're sitting far apart to reduce the chance of our infecting one another. But to your point, early on, the CDC said, it's not really going to be important for everybody to wear a mask. A lot of that it was two things. One is we didn't fully understand how effective masks can be, and there was a mask shortage. So we wanted to make sure that masks were available in hospitals where patients were being treated and where higher risk areas. Our manufacturing community throughout the country and throughout the world has really responded beautifully, and now masks are much more available. Inspiring stories about people sewing masks for hundreds of people and so forth. I mean, just wonderful. And more knowledge has come out, and most recently in a very reputable journal called Lancet, where looking at a number of different studies that have looked at this, not just one or two, but a lot of different ones, it really does show that masks reduce our risk. But let's be clear about this, and it goes to the social responsibility that you were talking about. If I wear a mask, it's not as much for my benefit as it is for your benefit and the other person who might be passing by me or standing next to me in line or whatever. Wearing masks is about caring for others at least as much, if not more, than it is about caring for ourselves. And this is one way that we can show in our community that we care about others. There's a lot of conversation about, well, it's my right not to wear a mask. It is. It absolutely is. And I think that people who feel adamantly about not wearing a mask may not fully understand how much it benefits their loved ones around them. And so I think mask wearing is probably one of the most important things we can do as a community to slow down the spread of the coronavirus, and that we can do for one another. Absolutely. We know that there are more people without symptoms that are passing it, and we know that even people who go on to develop symptoms can pass the virus to one another before they develop symptoms. So I think those are, again, things that we've learned. It's interesting information, but what do I do with that as an individual? Does that say, well, I'll only wear my mask 10, 20% of the time and I'll take my chances? That's an individual decision. But I would recommend that you don't, because again, the rest of us are relying on you wearing your mask. Should I go to this event or that event? I'm 20 years old and I'm healthy. I'm probably going to be fine. That's probably, that the odds are that that's true. But are you going to see grandma tomorrow? Or are you going to go to your friend's birthday party and someone there has diabetes or moderate asthma, and then you're going to give them the virus, or maybe next week, and then you're the source of significant disease, significant health issues, and maybe even their death? I would think we have to rethink this as a society. What do we want to do for one another? Again, I think it shows maybe a lack of understanding about what we're dealing with here. So it's about particle size, and it's about the pore size of a mask. The mask is going to have holes in it between the fabric weave, right? And so it's like talking about, since a BB can go through a volleyball net, well, a volleyball net must be completely ineffective for volleyballs or basketballs. A smell molecule is going to go through, absolutely, because it's a very small particle size, a molecule. Molecules make up proteins and other things, and proteins make up viruses, and viruses will glob together on an aerosol particle, a respiratory droplet, a droplet of water, a small invisible droplet of water. And so that will not get through a mask, but yes, a smell or something like that can. So again, I think that people maybe read this or read an opinion, and let's think through this and let's gain a larger understanding. That's where I'm hoping we can do that today, so that we think these things through a little bit for one another's benefit. Most likely, less likely, and even less likely. But it wasn't like 100% and zero. It's not black and white. It's all grades of gray in between. And each of us can tell a story about Uncle so-and-so who doesn't know where he got coronavirus. It must have been because he touched the gas pump or something like that. And yeah, those stories are out there. And so nothing's 100%, nothing's 0%. But to your point, what are the important, most effective things that we can do? The knowledge we have right now, it's wearing a mask, it's wearing eye protection if you're going to be close to someone, and if you can stay distanced as we are right now, that's good. That's good as well. Those are the three things that really came out of that article. I can't tell you, Scott, whether you should go to that rally or not, because I don't know how strongly you feel about that particular cause. And so that's, I think, weighing the risk of that. You need to decide how strongly you feel about it. What's your health? What's the health of your family members in your household? So in my household, we have family members that do have health issues that make it so that if I go to that rally and I get infected, but I'm going to be okay, but I have a family member in my home that if I pass it to them, they're not going to be okay. And let's just be really clear what those health risks are. Age over 65, diabetes, lung problems like moderate to severe asthma or other chronic lung problems, heart conditions, kidney and liver conditions, and obesity with what we call a BMI or a body mass index over 40, so severe obesity. These are risk factors so that if someone does get COVID in their home and their chance of having a very severe illness and dying are much higher. It doesn't make it more catchy for them. It just means that if they do get it, they're going to have a much worse outcome. So what's your individual situation as far as how strongly you feel about participating in that activity and what's going on in your health and the health of others around you? Weighing that, you then make your decision. And then if you do go, Can you wear a mask? Can you wear eye protection, sunglasses, goggles, something? Can you, as best you can, stay more than 6 feet away from other people? And can you sanitize your hands throughout wear a little hand sanitizer on your belt loop? Those are the things that we can do as we want to attend these events that are meaningful for us, whatever they are. So, great question. Again, let's talk about what's safe and what's not. Excuse me.
Or what's higher risk and what's
right.
lower
So
risk.
that's exactly it. So it's not an absolute, right? It's safe or it isn't. It is harder to socially distance on an airplane. The air is not as well, if you're outside, things are going to disperse into the atmosphere and fall to the ground more than they are on an airplane. So if you're going on a vacation that can be put off, and you've got some risk factors, either for you or someone in your home, that might be worth considering putting that visit off. If you have an urgent need to go on this trip, maybe there's a sick family member that you need to see, that's a totally different scenario. And so that's where I think, Emily, all of us have to make that decision for ourselves. So again, nothing's 100%. But there are some risks, but if you can sanitize the area around yourself, wear a mask, keep your hands sanitized, do the best you can to socially distance, you're going to reduce your risks. Now, doing that with a newborn or doing any of these activities with a newborn, whether it's going to a protest or a rally or flying on a plane, it appears that the younger you are, the lower the risk. So, and now I'm talking about people in their 20s and their teens and so forth. Newborns do not have a very adapted immune system yet. It's why we don't take them out in public for the first, couple of weeks, days, whatever that's comfortable for you. And so for a newborn, there is a problem with their immune system. Just naturally, it doesn't build up for a few weeks to months. And so that would be something you'd want to consider. If you could avoid that with your newborn, that would be better. If you can't avoid it, do what you can. It's hard to keep a mask on a newborn, but can you use some other sort of face covering, a shawl or something else? Let me be clear, I'm not an expert on that. And so it is something we know that if someone has, let's go back to the flu or a cold, and someone on the plane has it, your close proximity for a prolonged period of time is going to make it a little bit more risky. The airlines are doing everything they can to keep this safe for us, right? They're doing a great job cleaning the planes, ventilating them as well as they can. But again, nothing's 100%. That's a great question. The information that we have, the three things that again have come out of this recent compilation of a lot of studies would be a mask, eye protection, and hand hygiene, and staying farther apart. So those are four things. I said three. And staying more than 6 feet apart. So is it better to wear eye protection, wear goggles, wear sunglasses that wrap around more? Yes, it is. And so if you are comfortable doing that and you feel that you can do that in that situation, then we would encourage that definitely. We think it's definitely going to be more through nose and mouth. But when I cough, if I'm within a couple of feet of you and you don't have anything on, and I cough in your face and don't cover, or I sneeze and don't cover, some of those droplets are going to hit your eyes. You may not feel them, but because again, they're very small, but some of those are going to hit your eyes, and so you are going to have a risk of the virus entering in your body through that. That's the same again for colds and flu, right? And so having a mask is good, having eye protection is better. Sanitizing your hands frequently so you don't touch something that someone else did and then touch your eye or nose is going to be even better. But to your point, Scott, we're learning that that's probably not as common as through the eyes and the nose and the mouth primarily. We are learning more and more about how to take care of patients who are critically ill with this virus. And so our patients that are coming into our hospital, that are going to even to an ICU or heaven forbid, even on a ventilator, we are learning more and more about how to reduce their risks of dying. That doesn't mean we're eliminating them. And the risk is still, unfortunately, high. And obviously, if you're the family that's affected by that, it doesn't matter what the risk is, it's devastating. So let's be honest about that. So yes, that is the case. There are the use of masks and some of the other protective barriers that we're talking about today varies quite a bit from city to city, state to state, region to region, and even individuals, right? And we see this. And so I don't know that I could say that that's making as much a difference. The more we do, the better. And we do see there have been some studies that have looked at areas where face masks are mandatory in either the United States or in other areas around the world, and that we definitely do see less of a risk of transmission and the things that happen afterwards in those communities. I think it's going to be both. It's going to be those respiratory particles. If you're next to the person that's going, ah, he's lifting up that bench press. It looks like it's you, Scott, and it's clearly not me. I think if you're near someone and they've got their earbuds in and they're talking to someone who's in the bike a little ways over, yelling at them, you're going to see more respiratory droplets that way. So again, that's a calculated risk. If you can exercise at home and keep healthy that way, if you can go outside, go for a walk, a jog, a bike ride, whatever, that's probably going to be safer than going to the gym. If that option's not available to you, or your health and the health of your loved ones around you is such that that's a calculated risk, I think that that's an individual decision. But there are going to be increased risks of going to the gym versus not going to the gym. Does that mean that gyms are unsafe? No, again, it's a gray area, and our gym owners are doing everything they can do to keep things safe. What are the odds the person next to you is coronavirus positive? Depends on the community you live in, depends on the gym you go to, and we have no way of knowing that. So if you could exercise with a mask, even better. Hard to do, but that would be even better. I know the spread is not as bad yet, but it is going up, and we are seeing a rise where we're getting closer and closer to this point where it starts to look like this. Diseases spread not in a linear way, but in a geometric way. And what I mean by that, they don't just keep going up like this. At some point, they hit what's called an inflection point, and it has to do with things going like this. So it's the difference of 3 plus 3 or 3 to the third power. 3 plus 3 is 6, 3 to the third power is 9. And so the faster, as we grow, it hits a point where it goes up like that. We saw that in China, we saw that in Italy, we saw that in New York. We've seen it in different areas. And I'm not saying we're headed there, and it's going to happen tomorrow in Utah. We are heading in that direction, and that's where we need to see if we can, people talk about flattening that curve. Let's stay away from that point. Let's get our masks on. It doesn't mean we have to shut down the economy, but let's be responsible as we go out and we care for one another in this community. Outside is safer than inside. 6 feet apart is even better outside because you have lots of room. And if everyone's masked and has sunglasses on, that would be even better. Dexamethasone is a steroid drug. It reduces inflammation. One of the things that we know about people who are severely ill with coronavirus, and again, so we're talking about someone who is in an ICU on a ventilator. They're that sick. So we know that those people begin to have continued problems with their lungs and when they have actually inflammation in their lungs. The virus elicits inflammation in the lung, and that's what makes it so that air can't be exchanged in the lung, and that's why they need to be on a ventilator. Dexamethasone reduces inflammation. It's a drug like prednisone or Medrol that some of us may have taken as a pill that reduces inflammation. The data that we have right now is a press release from a study. We have not seen the study details yet. So the press release has told us that in those individuals that were treated with dexamethasone, the death rate from being on a ventilator went from 40% to 30%. So let's be really clear. This treatment may reduce the death rate by 10%. That is not what I would call a cure. It is not what I would jump up and down about unless I was one of those 10% or my family member was that was being treated. So we don't know all the information. Dexamethasone has side effects. It can actually increase the risk of other types of infections. So all of these things are balanced in a physician or a provider that's taking care of someone in the ICU. So yes, there's some initial promise, and we need to find out more about it and weigh all of those factors.
But it's not going to prevent somebody from getting it.
Absolutely not. In fact, it can. If you're those of us, another risk factor for those for people with coronavirus having a severe illness is actually suppression of their immune system early on. And so it's crazy. Like you're saying, well, no, you want to suppress the immune system. Yes, in the severely ill person who's really is really in a severe situation in the ICU, early on suppressing the immune system may make things worse. Well, I hope if anything we talked about face coverings and masks, and so it doesn't have to be a mask, it can be a bandana, it can be anything. But and the reason that you're wearing that is so that you can help other people. I don't know if today I'm infected, and that's why I'm staying 6 feet away from everybody. And the moment this microphone comes off my tie, I'm going to be putting my mask back on. And so those are the things that we can do to prevent the spread to other people, and then to keep ourselves safe: a mask, eye protection, hand sanitation, staying as far apart from others as possible.